Hey, welcome back, everybody. 9:08 is the time. Thanks for joining us on Good Morning Arkansas on this Monday. We're happy to have our interventional cardiologist, Dr. Patrick Flaherty of the Arkansas Heart Hospital, joining us this morning and talking about the correlation between erectile dysfunction and cardiovascular disease. Dr. Flaherty, great to see you. Thanks for coming in this morning.
Thanks for having me.
This is something that I think has really started to become more and more talked about. It's something we've seen commercials for years now. The little blue pill, you see so many different options for men out there and something like this. But today we're talking more about the correlation in the heart and the disease itself. But first, let's just talk a little bit about erectile dysfunction and what exactly it is.
Well, I think it's pretty self-explanatory to most folks, but it is basically the inability to achieve or sustain an erection for a man. But for medical purposes, we've now started to realize that there is a strong link between that arterial problem and other arterial problems in the body. For years, it was basically viewed as a social problem. And now we're realizing how much more of a medical problem it is, realizing that about 30% of folks over the age of 40 are going to have this at some point in their life, trying to figure out how we can link that together with other problems that they might come up with down the road.
Maybe more serious problems that can affect their well-being, which is something that's a little more, not talked about when it comes to ED.
Right. So we've come to find out that after the initial diagnosis of erectile dysfunction, we usually will start to see the cardiovascular events occurring within that 3 to 5 year period afterwards.
What causes it? Are there any other medical issues that kind of build up and maybe are linked to it?
Sure. I mean, historically, it's been things like diabetes, high blood pressure, sleep apnea is actually a big cause, depression, alcohol use, fatigue, all of this stuff. But now we're realizing that it's a link directly to vascular problems. Atherosclerosis, plaque in any artery is going to be predictive of not only a problem in that vascular bed, but also in the coronaries, carotids, and other vascular beds in the body.
What is atherosclerosis?
It's a formation of plaque.
Okay.
It's pretty basic. If you look at the artery as a hose, that hose or that rubber layer actually is a muscle layer, and the plaque forms in that layer and then eventually will migrate in and cause a restriction of blood flow. And it, in the heart, causes chest pain. In the legs, it causes leg pains. In other areas of the body, it'll cause individual problems that are related to that vascular bed.
Cholesterol is a term we always hear thrown around. Is that basically cholesterol buildup?
That's just one of the things that's there, but that's the primary thing that's going to be involved in these plaques that restrict the blood flow.
Okay, and what should you do if you think, go see your doctor, but let's talk about treatment options here. I mentioned what we see on TV. Are there anything else that we should keep in mind?
Sure, this falls into the category of, if you don't tell me about it, I can't help you. So, this is usually something that will come up as a "hey doc" type of thing at the end of a conversation that's unrelated. But you have to talk to your doctor about it, and you have to be able to individualize the care. You have to look for each individual thing that might be contributing to it, because frequently it'll be a lot of little different things that are playing into it. It could be a vascular blockage. It could be too much alcohol use. It could be a poor sleep pattern. It could be the first diagnosis of high blood pressure for a lot of men. You just have to talk about it, bring it up, and again, if you don't say anything about it, you can't fix it.
Do you think more men are saying something about it because it's maybe more open nowadays? You mentioned it used to be just considered a social issue, and now I think we're seeing all these commercials, these advertisements, and maybe more men being treated for other serious issues because they're asking about it these days.
I think it's a little bit of both. We've had such an aggressive advertising campaign for the various medications available for this over the last 20 years that it's become a part of a normal conversation, but we're also asking about it as part of our intake screening for folks when we first meet them.
Okay.
Are you having this as a problem? And if they flag it as yes, we'll talk about it a little bit more.
Okay, and if you want to talk about it with your doctor, of course, you can always call the Arkansas Heart Hospital. There's two numbers on your screen to remember here. There's a 501 number and a 1-800 number. Write both of those down right now. 501-219-7000. That's 501-219-7000. Or you can call the 1-800 number anytime. That's 1-800-264-5722, and they will be happy to take care of you at the Arkansas Heart Hospital, where they treat so much, including ED. Thanks so much for coming in today, Dr. Flaherty. Really appreciate you stopping by.
Absolutely.
And we'll talk sometime soon. All right, coming up next, we're going to